Welcome to the Courageous Canine Podcast. I'm your host, Michael Pickens, and today we have a very special guest, someone that I am very excited to interview because she combines both the best of Western and Eastern medicine together in her holistic, integrative veterinarian practice. So, Dr. Kristi Wilson, thank you so much for coming on.
Thank you so much for having me. Glad to be
Awesome.
here.
What got you on this path, on this journey that you're on right now?
So I was a conventional vet for the first 10 years of my career. And then my family had, my human family had a health crisis. And we had a lot of health problems within our family. And we were searching for answers that we weren't finding in conventional medicine. And so as we branched out of that, looking for a more long-term solution to the problems that we were facing, we discovered that with conventional medicine, you kind of hit some dead ends. And with holistic medicine, you just keep opening more doors and there's always more to learn. And there's really an infinite amount of knowledge that you can gain.
Gotcha. So it was your own difficulties and challenges with your family's health that kind of opened your eyes to a new way, I guess?
Yeah. And then also, I started working in the veterinary field when I was 15. I was cleaning kennels. And so even when I was a vet, I already had 10 years of experience of seeing the animals in the practice. And it was really interesting to watch, from 15 years of age for the next 30 years to watch the evolution of what pets are dealing with. And even with my own pets as a kid, like what health problems they had, and to sit back and say, oh, there's some changes. Like I definitely can see that global perspective. And, veterinarians have the advantage of seeing multiple lifespans within their career. Whereas if you go to a human doctor, they only see you maybe for a 3 or 4 year span of your life. They certainly don't usually see you from birth to death, the same doctor. And we veterinarians get to see animals from birth to death multiple times over multiple generations. So we can make these, really, it's interesting to just kind of sit back and see the differences in those generations through the years.
Gotcha. So what kind of separates your practice from a traditional veterinarian that most people will be familiar with?
Well, I started out as a conventional veterinarian and I was doing all of the things that conventional vets do with vaccinations and pharmaceuticals and recommending, the name brand kibble. And so I did all of that. And, I didn't go from that to being holistic overnight. I evolved over time and I keep evolving. I'm constantly learning. I'm constantly gaining new information. And the vet that I am today is not the vet that I was 3 months ago because I constantly learn. And every time I learn, I'm better, newer, and more improved. So I would say that, my practice now in what it is, after being on this holistic road for the past 15 years is it's pretty drastically not what I was doing before. I'm really meticulous about root cause of disease. So I don't even have to touch an animal to be able to make observations, just like a drive-by diagnosis. I could see a dog walking down the street and, you're constantly looking at the way they walk and their body composition, how their fur lays, their hydration, their fascia, their mood, their response to your dogs. And, so it's like you're constantly seeing this holistic view of the world, even without getting your hands on the patient. So, and then when you do get the opportunity to get your hands on the patient, then you can even have a better assessment.
Yeah. So you brought up the word holistic. What does that mean to you? What does the word holistic mean?
So holistic means that we're not just treating the symptoms. We're not just covering up the pet's coming in for diarrhea. We're going to give it an antibiotic. That's what I did in the past. I would never do that now. So pet's coming in for diarrhea. Why is it having diarrhea? And there's not two pets that have the same answer for that. I mean, it's really, when you're talking about holistic medicine, you're getting away from the algorithmic approach of medicine. So in conventional medicine, you have an algorithm. You're like, okay, if the pet comes in for diarrhea, you do a fecal test, you prescribe this usually an antibiotic. You can, so there's a certain approach that basically every pet gets the same kind of first layer of treatment. And then if a pet comes into a conventional practice again with the same problem, then they go into the second layer of their algorithm. And that's but every pet with diarrhea is kind of on the same algorithm. They do separate it out, whether it's small bowel or large bowel. But when you're talking in holistic medicine, that pet maybe had a new baby born in the house, and that disrupted that pet's, psychological state. They were stressed, or maybe they changed the food too quickly, or maybe they got a parasite from swimming in the creek, so it's much more of a puzzle where we don't have a box that we're checking. We're doing more investigating, and it's a broader brushstroke to think about the animal in mind, body, and spirit.
Yeah, that makes sense. You're going to have to look at all the issues. I know when I take my dog on hikes, long hikes, and, I get her all excited beforehand. We're going to go on a hike. Let's go get in the truck. And then, we're driving out there and she knows where we're going, right? But it's a, 15-minute drive. And then when we get there, she jumps out and then she has to go to the bathroom. Like, and sometimes it's diarrhea because she's so excited or,
Yeah.
But that's you can see the cause on what happened before that, right? And knowing that she doesn't need antibiotics or anything else like that.
Yeah. I mean, that's one thing I say is that, if a pet has diarrhea that's acute, really, if you stop feeding them for 24 hours, such a huge percentage of them will resolve. It'll resolve. And that's free, we have to manage our own emotions around it because people get upset when they have to clean the rug and all of that. And the pets, they feel like their pet is suffering. But if you just withhold the food, which for some people is like cutting off their leg, they're so worried. It's like, oh my gosh, I can't withhold food for 24 hours. But really, the pet will be okay and they'll feel better for it. I mean, fasting is so medicinal.
Yeah. And in nature, like the dog isn't getting, 3 meals a day.
Correct. Yeah. Yeah.
What are some other myths in veterinarian care that you know of? Like, or long-held beliefs that aren't really, true?
Well, I mean, so there's one of the things that's starting to be exposed is the whole spay-neuter conversation. That's something that's really, Dr. Karen Becker is doing a lot to expose that. And I'm totally, bought into that, the whole thing. I mean, there's a lot to it. It's not like a black and white answer, but that's a real, there's definitely a lot to come out about that.
Gotcha. So are you saying that it's more detrimental to a dog to spay and neuter?
So hormones are essential to every life process. So the body is, so I think in the past, my normal as a general practitioner was a spayed and neutered dog. And that was considered a healthy animal. And when you had a pet that came in that was intact, that pet was considered at risk for disease. And so when I practiced this way for the first 10 years of my career where, if the pet's not spayed and neutered, it's a 911 emergency to get that pet spayed and neutered. And because we thought we were doing good. I mean, we thought we were preventing health problems by doing that. And,
Yeah, you had Bob Barker on The Price is Right every single episode. Get your dog spayed or neutered, right?
Well, and the funny thing is that I'm a huge proponent of rescue, and I always have been. I've worked in rescue since I was a teenager. And I absolutely have such a heart for stray animals and and overcrowded shelters. And, not what I'm not trying to say is that every pet should go and reproduce and have litter after litter and bog down the system and all these animals have to be euthanized. So, and, with spay and neuter, basically every, as I started to say, every hormones are so important to the body, to the skeleton, to preventing osteoarthritis, to the heart health, to the immune status, to their resilience, even with allergies and cognitive function. If you truly want your pet to live a really long and vibrantly healthy life, one of the things that you can consider is that their hormones are really important in making that happen. We've been trained to focus on the fact that animals get breast cancer when they are not spayed. And there's a lot more to that conversation because, I'm a breast cancer survivor myself. I had advanced breast cancer and it was hormone positive. And the things that I'll say here are going to kind of weave in and out of humans and animals. I'm not trying to give human advice. I'm saying these things because I'm a survivor of advanced hormone positive breast cancer. And so I would like to plant a seed, but the things that I'm saying about humans are not standard of care right now. And I think that is something that needs to change. And that's my opinion. So, but in animals, there's a lot of data that's emerging. So basically the breasts are lymphatic watersheds. So on the animals, they're located on the ventrum of the dog and they're full of lymphatics, lymph nodes and lymphatic vessels. And basically when an animal has a lot of toxicity, their lymphatics are really clogged with all of those toxins, whether it be from bad dog food or whether it be from flea and tick products or pharmaceuticals or lawn fertilizer. There's so many toxins constantly bombarding these dogs, and they're going to go through the lymphatic system. And the lymphatic system is a system of vessels in the body that are just like blood vessels. But the difference between the lymphatics and the circulatory system is that the circulatory system has a heart to pump the blood. And the lymphatic system does not have a heart to pump the blood. It has no pump at all. And it relies on the movement of the skeleton in order to properly pump. And, for example, testosterone supports the muscles. And so if the animal has more muscles because they're hormones, they're going to move their lymphatics more efficiently. And if an animal so basically, we in the past have been recommending that we should spay dogs to prevent breast cancer. Well, that's one way to handle it. Okay, because many dogs have hormone-driven breast cancer, if animals have a lot of toxicity, they have a lot of really bad hormones. There are good hormones and bad hormones, and the bad hormones are like xenoestrogens and hormone-disrupting chemicals. And so if they're very toxic, they're going to have a lot of those. So then we can just spay them and cut out all the hormones. And then the pet's risk of breast cancer is almost zero. But their risk of all kinds of other cancers, many other cancers, goes way up because they have no hormones, because they've affected their immune system. They've affected their muscle. They've affected everything. And so we want to, I think, with breast cancer for myself, my breast cancer was hormone positive, and I've been through a long road with my own hormones, and I take hormone replacement therapy now, against the advice of my doctors. But there is so much more to this story. And really, we need to be focusing on the detoxification pathways, the methylation, the toxic burden, the food the pet is eating, their movement. And that's how we address breast cancer from a holistic perspective. And we recognize that the hormones actually serve a function. We just want we want healthy hormones so that the functions can be carried out properly.
Yeah. Well, that's great. Well, it's not great. Dogs getting breast cancer or, so much confusion around this issue, but it's great that you're, talking about it, having a discussion about this, blanket treatment that it seems that, every dog parent is being told to do
Well,
immediately.
and I will say, it gets real when you have a situation where you have an intact male and an intact female in the
Hmm.
house.
Yeah.
Because all of a sudden you're having you know, the wild, it gets a little wild. I mean, I have a client that has an intact male, very driven Belgian Malinois, who's the most beautiful, high performing dog. And she has another dog that's an intact female in her house. And she doesn't want puppies. She
Yeah.
just wants her dogs to be optimally healthy. And the amount of work that it takes her to keep these dogs separated when her female is in heat, there's no way that the average
Yeah.
person is going to be willing to do that. And so we have to keep it real.
Hmm.
We can't optimize everything. I would say certainly we need to raise awareness of this because right now the rescues have changed laws, not the rescues, the governing bodies of certain states have changed laws that are requiring the rescues to be spayed and neutered before they're adopted. So you're taking an 8-week-old puppy and you're spaying and neutering them, and you are literally setting that puppy up for a lifetime of problems.
Oh
Um,
no.
they gave it a name. Actually, Dr. Karen Becker gave it a name called spay and neuter syndrome. And that I'm so glad that they've named it because I've been seeing this for years, but I didn't have a name for it. I'm like, oh, when did you spay? When did you spay this puppy? They say she got spayed when we adopted her at 8 weeks old. Like, no wonder this dog has thyroid problems. No wonder this dog has allergies. No wonder this dog has a low metabolism. You
Oh
know,
yeah.
those dogs, when I see them, they're like Eeyore. They're tired. They're overweight. They got so many issues, and they're often really young. So I'm so glad that this awareness is happening, and we need to change it. We need to just spread the word about this so that we can change this legislation that is hurting the dogs.
Yeah. Well, I'm glad you're doing it.
Well, with your help, right?
Absolutely. So what are some other things that kind of sets you apart from other veterinarians? Here's something. Clipping their tails.
Mm-hmm.
Like as puppies, what does that do to affect their health? Do you have
So I actually have
anything on
a
that?
couple of boxers in my practice that have long tails, and they're so cute. I think that the whole tail clipping thing happened because of aesthetics, for one. And then the other reason is because many of the breeds that have tails amputated when they're young is because their tails have thin hair and they tend to be long and the tail doesn't get very good circulation and they can injure them, functionally from that perspective.
Mhm.
But the tail, I'm a proponent of leaving an animal the way that it was intended to be. So I think it goes along with the same lines as tacking the stomach in a deep chested dog. I mean, if you believe that these pets were created imperfectly and we need to intervene, then you're buying into this whole system. My own preference is to leave them the way that they are. Now, I have seen tails have to be amputated because they have been so, functionally
Damaged.
hurt. Yeah. But, we have so many modalities in our practice that would help to bring blood supply to that tail to heal it. But certainly there are exceptions to that rule. And, like the tacking of the dog's stomachs, like there's a whole lot more to that story as far as the microbiome goes and the toxicity level in that dog. And the stomach and the intestines are supposed to freely move in the abdomen, and they're supposed to be constantly moving to optimize digestion. So, and I even did those surgeries. I actually tacked stomachs when I would do space. I would do prophylactic gastropexy. That was something I did. I liked it. I was good at it. Now I'm like, why in the world did I tack those stomachs?
Yeah, can you explain that? Because I've actually never heard of that.
Oh, really?
What is tacking the
So
stomach?
basically what they do in deep-chested dogs have this very deep thorax. So their chest is very deep and their stomach is lying right up against that diaphragm. And so what can happen is that stomach can get filled with air. And there are lots of different reasons that that could happen. If the animal is eating really fast and gulping a bunch of air, if they're eating kibble that is fermenting differently in the stomach than a species appropriate diet, then they're going to have more gas produced in that. And then so there's a lot of different input to that. And so what happens is that the pet can acutely, like all of a sudden, their stomach can flip on itself and it can cut off their inflow and outflow of the stomach. So it's a life-threatening emergency. And basically their abdomen swells up like a basketball and they have to go immediately and have that. Usually they end up in surgery. Sometimes they can relieve it using a tube down their throat. But many of those end up in surgery and some of them even die. And so people are worried about that. If they have a Great Dane or a big Doberman, they know that it's called gastric dilatation and volvulus. So they know this is a risk in these deep chested breeds. So it's kind of become something that's been common to recommend that these dogs, when they go in to get spayed, that they get their stomach tacked. And I would say there's so much more to that. And when I did the surgery, I would take a little slice in the stomach and I would kind of like make it kiss the side of the abdomen, the body wall. And I would suture it to the body wall. So then the stomach is stuck there permanently. So it can't flip. I suppose it could if it wasn't done properly, but it makes it almost not happen. But the thing is, there's so much more to that story. And one thing I'll say is in that sentence I just said, you bring them in for their spay and their gastropexy at the same time. Well, we know that when you remove the hormones from a dog, you decrease their muscle tone. So that's their core muscle strength as well, So isn't that interesting? You're spaying the dog, you're decreasing their overall core strength, and then you're tacking their stomach. I'm not saying there aren't exceptions to that rule. And that's
sure.
It's a really difficult scenario because no one wants to go through that with their dog. But there's so much more holistically to that story. And my preference is always to default to what the body is intended to do.
Yeah. So what are some things that you can do besides the surgery? Do you just monitor the dog?
No, so basically you want to emulate what that dog's natural digestion is supposed to be, so you want to feed the closest to a species appropriate diet that you can. And this is where, financially people say, oh, well, feeding raw food is so expensive or feeding fresh food is so expensive. But, tacking the stomach is expensive. So it's like, do you want to pay your doctor or pay your farmer? So definitely fresh food is a place to start. But I have heard of dogs that are raw fed that have still had gastric dilatation and volvulus. I would say I believe that it is overrepresented in the kibble population and is less common in dogs that are raw fed. But the other thing is that when we're raw feeding dogs, we're just like handing them their food all nicely blendered, So it's like very easy for them to just inhale it. And you imagine in the wild when an animal is eating like that, they're not going to just inhale it in 2 seconds. They're going to have to rip it and they're going to have to do some work. And so that's part of it, just trying to make sure they don't gobble down their food super quick and inhale a bunch of air. Letting them not have them participate in high intensity exercise right after they finished eating. So you don't want to feed your dog a huge meal, have them gobble it up, and then take them for a run. So, give them a minute, give them some time to digest their food.
Gotcha.
And then again, the spay and neuter status of those dogs. I don't know of any studies that have been done on that. This is all being based, on what makes sense to me, which is that spaying and neutering decreases their core strength, and the core strength is very important to keeping the organs all in the place that they're supposed to be.
Cool. Sorry, I was actually looking it up and looking up pictures of it in the different stages.
Yeah.
Very interesting. Cool. So you had talked a lot about immune system optimization. You also have some new technologies that you're working with. Do you want to talk about that?
Sure. So that is something, ask me what separates me from other vets. I mean, I'm I'm probably in a very small percentage of vets with the things that I do. And doing this modality, which I'll talk about, is called bioresonance. And bioresonance is basically an energy that's put out by every cell of an animal or a person's body. And you can use a machine to assess that electrical output. And then you can try to bring the body back to homeostasis by using this kind of combination of muscle testing with AI. And so I'm in a very small pool of veterinarians who are doing that. And it is something that's becoming more widely known and more widely accepted. And it is a pretty powerful modality because have you ever heard of muscle testing? Do you know what I'm talking about?
Yeah. You put your arm out basically,
Yes.
and they hand you a product or something else, and they can tell
Yeah.
whether or not. Yep.
And there are some people who are fantastic at muscle testing. So they can pull out 10 supplements and figure out which 2 supplements you need in about a minute, And it gets harder to do that with animals because you need a surrogate, and it's just a little bit harder to do it with animals. But like you would need a person. Some people can do it straight with the animal. I mean, it's really an art. The people who are good at it are very good at it. I tend to be a little bit too much in my head where my brain is always thinking. And so that makes it harder for me to be objective when I'm muscle testing. So I found this bioenergetic machine about 3 years ago, and it was the perfect solution for me because I didn't have to get out of my own brain. The machine would just do the work. So I can still do all of my thinking about the different modalities in my head because really I'm operating with naturopathic medicine, integrative, functional, Chinese medicine. I draw from so many, I use energetic medicine. I have lasers, I have PEMF. So I draw from so many different things. And every patient, I'm just thinking, okay, what am I going to use next for this patient? And basically using a bioenergetic machine allows me to load in all of those therapies and load in all of my supplements and then tailor that protocol for that patient to the individual needs. And it's like, it saves people money too, because, I'm trained in Chinese medicine and we use a lot of Chinese herbs in practice. And prior to using bioenergetics, sometimes it'd be like, okay, I've got 20 herbs up there for GI problems. And, which one is the right one? And so you try to find the Chinese medicine pattern that matches that most closely. But when you're using bioenergetics, the energy of the cell is going to match that pet with the herb that is maybe not visible to our human brains.
Yeah.
And so it continues to just flabbergast me, the things that this machine helps me with. It basically, I'm like, oh yeah, that makes total sense. I never trust the machine implicitly. Like I never just say, okay, the machine said that, that's what we're going to do. I always use my head to make sure that I agree with what it says. But I'll tell you what, 99% of the time, I agree with the machine. And there's occasionally 1% of the time where I think, I just can't see that pattern. Like, I just can't believe that that's right. And then I'll uncheck it and say, we're not going to use that. And then I'll pick something else. But it's pretty crazy how accurate it can be for the things that I'm using it for. And I get the best results I've had of my whole career have been using that machine. And so it's very rewarding because I'm able to tailor everything that I do to the individual needs of the patient. And up until now, I've always had an in-person practice, and that was the wheelhouse of my business. But I have so many patients on my waiting list, and I have such a burning fire to be able to help more than I'm like, how can I let these pets, there's pets dying, waiting, to get these modalities. And so I'm in the process of creating a secondary company, which is a virtual version of what I do in person. And I don't think it's as good as a client-patient relationship in person, but it's almost as good. And there are a lot of people who don't have access to holistic veterinarians or these modalities. And so it's really, really exciting and hopeful to be able to to cast a broader net and be able to help more pets.
Yeah. So when are you launching that?
It's coming. It's getting closer. We're just doing the final touches on the website right now. It's called Hope Energetics for Animals.
Hope Energetics for Animals.
Yes.
Awesome. And then your current website is
Hope Healing for Animals.
hopehealingforanimals.com. And this is for your Denver-based practice, correct?
Yes. Mm-hmm.
Awesome. So right now, if someone wants to hire you to help their dog or their cat, they would have to go in person.
Well, so right now, if someone wants to get on our radar, I would say go to the Hope Healing for Animals website. It's all spelled out, hopehealingforanimals.com. Go to the Hope Healing for Animals website, put your name on the waiting list, and very soon we'll be reaching out to those people to offer a virtual appointment to be able to, or virtual help with this Hope Energetics that we can do.
Gotcha.
Hope Energetics is not intended to be a replacement for your local veterinarian. It's intended to be a way that people can access holistic care for their pet that's tailored to the needs of their pet. And it's as good as we can do without having everybody in person.
Gotcha. Well, I'm going to hire you for my dogs because I've got some questions, but we're coming up on the end of half an hour, and I don't want to take up too much of your time.
Yeah.
I know you're busy, but yeah, I do appreciate you coming on. Is there anything else you'd like to share?
No, I really appreciate you having me. This has been lovely, and I thank you so much for reaching out.
Yeah, and let me know, because we have a big email list of like over 1,000 people. So once you're up and running, I'd love to refer you out. Obviously, we are trying to promote more holistic routes when it comes to canine health. So I thank you for everything you're doing.
Yeah, thank you so much. I look forward to collaborating with you.
Absolutely. So if you're interested in working with Dr. Kristi Wilson, you can head over to hopehealingforanimals.com. And then you said your new website that's going to be coming out is what?
HopeEnergeticsForAnimals.com.
Hope Energetics. Awesome. Well, thank you so much. I really appreciate it.
Thank you so much for having me. It's been a pleasure.
Howie Mandel here. I might not be a vet or a dog whisperer, but I know a thing or two about keeping things entertaining and healthy, just like your dog needs to be. Botanical Enlightenment Canine is all about high-quality, human-grade ingredients with no fillers. Their joint and mobility formula is packed with tons of great stuff like glucosamine, MSM, and more to keep your dog's tail wagging. Give your dog the gift of health and save some bones while you're at it with code HOWIE15 for 15% off at bcanine.com. I love liver. Is there any way that I can have some?